I think that the bigger question is in the grand scheme of things, given all of the local transmission of the virus here in Canada, how much is this actually going to contribute, especially if people are being still quarantined for 14 days when they arrive? I don't think it's a bad idea. I just don't think this is going to be, a big answer to our problems. This would be more important, I think, once we really start to open up travel again, and there's still some concern that we might restart something here in Canada.
Yeah, presumably it helps to underline the message, those returning, even those here, and all of that, about how serious the situation is. But let's talk about logistics. Some have anticipated the idea of you're in a foreign country, and are you essentially shopping around for an appropriate test, and presumably paying for it yourself as well, but even the finding of it would be a challenge, would it not?
Potentially, yeah. And these are the things that, as the airlines say, have to be worked out. I mean, this could also be a role for the rapid tests, which aren't quite as accurate as the more standard PCR tests with the nasopharyngeal swab. But this could be a role for those more rapid tests where you can get a result within half an hour or so. But I haven't heard that happening. So I'm really unclear as to how exactly this is going to work. It needs to be worked out for sure.
Let's pivot to the discussions around that new strain. Of course, first identified in the UK, it spread to Europe. We have a number of cases here in this country. Could that testing before getting on flights have any impact on the spread and the further arrival of that new variant in this country?
Yeah, potentially. I mean, if you want to try to control something, you want to control it early, right? So for the strains that we've been dealing with now over the last year, as I said earlier, I'm not sure how much this testing is going to help. If you're trying to prevent, yet another new variant showing up in the country, you want to do it early, and this potentially could be a strategy for that. We do have to remember that there's been a number of new strains that have shown up and that have started to predominate around the world. This is just the latest one. One just happens to have really good press. It's really got legs and it's been talked about a lot, but it's still unclear exactly what the mechanics of this virus are, and that still needs to be worked out. All we're hearing is sort of people hypothesizing about this new strain, and it's as a scientist, it's a bit frustrating because we haven't seen any papers actually describing what's going on.
But as a scientist, are you potentially concerned about the arrival of a strain that contributes to a greater caseload that could impact the healthcare system?
Certainly, if that is the case, yes. And I think that, it still remains to be seen if we can tease out more in the lab exactly how much better this binds to the spike protein, et cetera. Those details need to be worked out. But certainly, it is very reasonable to be concerned about this and to, reinforce the fact that our control measures need to continue. Because if this is indeed a lot more spreadable, then we don't want it spreading. I mean, it's really that simple.
Let's talk vaccines. Britain approved the Oxford AstraZeneca vaccine for use. There were some discussions, maybe even some confusion around the efficacy of it. Do you have any concerns about that, and how might a third vaccine, if approved in this country, affect our battle with the other two we already have on stream?
Yes, absolutely. I mean, this particular vaccine was sort of seen as the world's vaccine because it was cheap to make. You didn't have to have any special freezers for it. And so there was a lot of hope in this vaccine. To me, what's been really, I think, quite striking is the lack of hard data on exactly how well this vaccine works. It was about a month ago that we heard, there were actual mistakes made during the original big trial, which made it confusing in terms of how well it works. And the latest press releases from AstraZeneca from the CEO have basically said, trust us, it works fine. But I haven't seen any information to tell me exactly how well it's working. And I have to assume the British government saw something in there that allowed them to approve it. But I definitely want to hear more about this vaccine. I don't feel as confident in terms of how well it works compared to the Pfizer and the Moderna vaccine.
One more quick question for you, Doctor. Ontario set a new daily record, COVID-19 cases, almost 3,000, over 1,000 in the city of Toronto. Can you talk about this horse race, if you will, between the arrival and the injection of vaccines and the virus as it continues to grow? How does that play out? And is it about vaccines, or is it about all those other health measures we've been told about for so long?
I mean, I think it's about everything, but certainly in terms of the horse race, the virus is winning. We're not going to have enough vaccine and the ability to give enough vaccine to the general public for several more months yet. And so the virus has a pretty big head start here, and things will continue to get worse without more strict application of those public health measures that we are all so incredibly sick of. We're not going to be able to vaccinate people fast enough to really change the course of this until far later in the spring.